All right, I think we'll get started. We have a quick 30-minute webinar for you guys today. It's good to see some familiar names and faces, and we're excited to kind of give you some information around this new health plan action guide. And so I'm Christina Turpin. I'm a director for the National HPV Vaccination Roundtable, and I am joined by Katie, who I will hand it over to. Thanks.
Thanks so much, Tina. Hi, I'm Katie Crawford. I am the Senior Payer Engagement Manager here at the American Cancer Society. I'm super excited to share some of our work around health plans and specifically the action guide today. I want to thank everyone who's contributed to this project over the last year as well. Next slide. So who are we? The American Cancer Society and the National HPV Vaccination Roundtable are under one umbrella organization, and our vision is to end cancer as we know it for everyone. And we do that through the lens of advocacy, prevention, early detection, treatment, and survivorship. Next slide. So I'm going to sort of set the stage with all of you and talk about our health plan learning collaborative that really served as the catalyst for development of the HPV action guide. Next slide. So we have been working with health plans around HPV vaccination for several years now. In 2021, we launched a pilot project of a health plan learning collaborative. For the last 3.5 years, we have been continuing that project. And in 2024, currently, we have almost 30 health plans participating with us in the learning collaborative. Next slide. So the objectives of the cohort are very simple. We bring our health plan partners together. They participate in bi-monthly or quarterly calls, and we really ask them to show up, be engaged, and share. So we're looking to increase HPV on-time vaccination rates and reduce barriers to care, increase understanding of effective strategies, create a comprehensive quality improvement plan, and really include that ACS team member as well. Embrace a culture of team-based quality improvement, utilize data, specifically looking at both first and second dose data to inform aspects of the project, implement effective EBIs, execute sustainable and meaningful process management and improvement, and then most importantly, share resources, successes, and challenges. So this is really an all teach, all learn type of project. Next slide. So this is a little bit about our learning collaborative from last year. So we had 19 product lines participate from 14 different plans. 11 of those plans were continuing plans from 2022. They reached over 127,000 age 13 eligible patients, and they were able to reach 68,000 new members with initiation and 43,000 members to complete the series. So we were really excited that we started to see some really significant increases in completion rates. So over that year project, we did see a 3% rate change in completion for the HPV vaccination, as well as the IMA measure overall. Next slide. So some of the successes that we have seen through the project are the addition of HPV-specific member incentives, updating member outreach lists to include 9 through 13-year-olds, really focusing on initiation at age 9 has been a big topic of interest for our health plans, outreach to adolescents who need that second dose, and then using reminders to reduce the no-show rates. So some of our health plans have seen challenges around the length of approval processes for new materials, which I'm sure a lot of you also can understand, limited use of member websites, and then also incorrect member information, especially with a lot of our Medicaid plans is something that we've heard. Next slide, please. So some of the provider-directed interventions that we have seen are success around the addition of HPV-specific provider incentives, vaccination gap lists. So really making sure those health plans and those providers are working together to provide those gap lists. And then the addition of HPV vaccination resources for their provider website and newsletters. We still continue to hear issues around pushback from providers at starting vaccination at age 9, and then obviously clinical staff turnover, leadership changes. Next slide. So some of the lessons learned from the Learning Collaborative is that this has been an important project for our partners. They're excited to learn from ACS and their peers. The health plans have been able to report and utilize HPV data to a greater extent, and really have been able to utilize some of the promotion and the use of materials that ACS has been able to create over the last several years. Challenges remain that they need more than 12 months to see robust outcomes, and that they really need to create stronger, more robust teams internally. And unfortunately, the HEDIS measure is also at times a challenge because they are assessing progress on ages 9 to 12, which does not meet that HEDIS measure. Next slide. So, in recognition of the project and the success and the interest in coming together and bringing these health plans together, we decided in the summer of 2023 to host a health plan summit where we brought folks together in person, and we were able to do some real workshop as well as didactic presentations with our health plan partners. So we were able to convene 20 health plans from across the country. Here in Indianapolis, that included around 55 clinical and QI leaders, as well as HPV researchers, industry partners, and national experts to discuss promising practices and troubleshoot with their peers. So we spent some of the workshop in didactic conversations, subject matter expert presentations, and then the other half of the workshop in really intense data sharing and learning from our health plans as to what is moving the dial and what are the challenges around HPV vaccination, which was really what we took to then formulate this action guide. Next slide. So the way that we went about this is we divided our room into 3 different areas: provider engagement, member engagement, and then starting HPV at age 9. And we really wanted to better understand what our health plans were currently doing, what they had planned but not implemented, and then if the sky's the limit, if they would, they could. And we really asked them to tell us everything that they were able to do at their health plans around closing gaps in care around HPV vaccination. And we were able to learn a lot around provider incentives, provider outreach, training, standing orders, reminders, education, provider reminders. Just the sky's the limit. We tried to get as much information. And again, we are so appreciative to all those that participated because they worked really hard over those 2 days. Next slide. So after we had really mined them for all that information, then we went into smaller group discussions. And we really wanted to understand, what EBIs are going to rise to the top. What's going to make a health plan more nimble in executing EBIs and working with providers and members to advance HPV vaccination efforts. So we discussed how health plans can deepen or innovate interventions to improve provider communication, engagement, and EBIs. How can a health plan best reach members and other stakeholders? And then how health plans can promote HPV vaccination starting at age 9. So as I mentioned, after this 2-day workshop, we took all of the information that we had gathered, and that's when we started formulating the action guide that Tina is going to go over in just a moment. And again, we're so appreciative to all those that helped us. We had several health plans that not only came together to help us, get all this great information, but then we had several health plans that have stuck with us over this last year to review the action guide. We've done further in-depth interviews with those health plan partners to make sure that, the action guide is concise, easy to read, that it's hitting on all the points that you are going to need to make the case for HPV vaccination at your health plans. Next slide. Okay, and I think I'm going to turn it over to Tina, and Tina's going to walk through the action guide with you.
Yeah, thanks, Katie. And I just threw the link to the action guide if you guys didn't already have it. I'm going to go through each page of the action guide, but the links are clickable for you if you pull up that action guide. And if there's anything that interests you on the slides that I have, you can go ahead and pull that. We also have a landing page for health plans. I'm going to go ahead and share just for you guys to bookmark and have. We'll be adding this session to that to see, so you can share that with partners or anyone you'd like as well. Next slide. So Katie really set up the scene well of how this came about. It was very thoughtful. We pulled in a lot of partners, and now you can kind of see the final product of what we want to share with you. So here's the title page, Cancer Prevention Through HPV Vaccination, and then table of contents. Not very exciting there. Next page. And then here we have our acknowledgements for funding and just a collaborative project between ACS and the Roundtable. And this first page we really love here, where it sets up the scene for the data side, the problem, the solution. We know that HPV vaccination is cancer prevention and that health plans play a critical role in this. And you can see over here, we also talk about why to prioritize HPV vaccination: decrease costs, that total economic burden of 2.9 billion, and cervical cancer care costs in 2020 of being 2.3 billion. So we see that there. And Katie touched on this as well around the HEDIS IMA performance measure. So that is another reason to prioritize HPV vaccination. Next page. And as I'm going through these, you'll see I pull out little pieces of this, but I hope, and Katie and I really hope, that you guys dive into this, that you picture yourselves and your work in this and where you can start. I know we have each action. It doesn't mean action 1 needs to always come before action 2, before action 3. You're all starting from different places. So really take this information in. This will be a quick overview, but it's the start or the continuation of conversations as well. And you'll see these blue boxes, the dark blue boxes are action items as we go through here. So action 1, we have form an HPV vaccination team. So this would be pulling together those people that will champion the HPV vaccination. And you can consider provider engagement, member, population health, IT, QI, dental, pharmacy. So that full team should encompass everyone that can really help promote the HPV vaccination within your plan.
Yeah, and Tina, we saw a lot of this in the Learning Collaborative, where quality is most often driving these efforts. And, our plan partners are really busy and they're focused on lots of different measures. But once they were able to really bring in their member engagement and their provider engagement and IT and work together as a team, they really saw that they were able to develop a more cohesive, comprehensive plan. So definitely think about who you are sitting down at the table with.
Yeah, Katie, that's a great point. We did hear a lot of that, of people being like, well, we really want to pull data, but that's a roadblock for us. So it's thinking through, like you said, the IT, the QI people you can pull in so that when you put a plan together, it's rolling. You're not getting these roadblocks and the roadblocks. And so that's why I really love that this is action 1, because it'll really support the rest of the actions going forward as well. So action 2, make a business case for HPV vaccination and secure leadership support. We know that leadership buy-in with the health plans plays a huge role in the prioritization of HPV vaccination. And so as you're doing that, you can use that first page we talked about, that why prioritize HPV vaccination. That is a really good resource. And then you can see in this action item box, create a 1-page brief to present the business case. And you can use kind of that above stuff. So evaluating your health plan spending on the following: HPV-related cancers, screening, diagnostic, treatment, positive, HPV tests, all of that you can put into this business case for leadership. Did you have anything, Katie, on this action 2?
No, but I think that was one of the things that we did in the start of the summit, is we did help health plans we laid that business case out for them. And it really did help. We brought in a survivor and a caregiver and made sure that they shared their story. And that was part of making that case. I think that folks were able to to have more of a connection. So, one of the things that we did hear from our plans that I think also resonated around these lines is my patient or my member today might be your member tomorrow, and vice versa.
Yeah. I think that was one of our favorite moments of the whole in-person was that phrase, because it was really that collaborative effort of we're all in this together, increasing HPV vaccination, and how can we help each other out? And it was a really cool thing to be a part of. Next slide. Action 3, promote a cancer prevention narrative. So this one, if you have been on a call with Katie and I before, you know that is a top priority for us, cancer prevention. And you can see down there some example evidence-based messages. The HPV vaccine prevents 6 types of cancer. HPV vaccination is safe and effective. We give you some of these helpful phrases, and you can see just kind of bringing it back to the action guide. We have different links throughout for ACS or the roundtable that will take you directly to resources that'll help you with this messaging, that'll take you to one-pagers that can educate on this as well. And so you can kind of see that in your action item to review existing HPV vaccination materials for providers, for members. Do they talk about HPV vaccination as cancer prevention? And that's such a key message that obviously us as American Cancer Society are really promoting, but also is what, to Katie's point of talking to survivors and caregivers, that's what it's all about. We're preventing cancer. And so we really want to make sure that patients are getting that message when they're in clinic. Katie?
Yeah, again, the first year of the Learning Collaborative, we had 4 plans that indicated they weren't talking about HPV as a cancer prevention vaccine. So that's a really easy, quick win for everyone. And ACS is really happy to help you with that. We have, as Tina mentioned, we've got lots of resources that are ready to use. So, we're happy to help you deliver that message.
Yeah. And as we're talking, if you guys think of questions or anything, we're not sure how much time at the end, but we also will reach back out with any kind of needs you guys have. So action 4, promote the HPV vaccine starting at age 9. This is where I can full-heartedly say we have more than enough resources for you guys to promote this message of starting HPV at age 9. You can see here different resources such as benefits of starting at age 9. And then we even go into some example evidence-based messaging, which is really helpful if you're just starting out in the age 9 world, talking about it. So we talk about vaccination at younger ages generates a stronger immune response than later vaccination. And all of this is science-based. So if you're reading this message and you're like, where does that come from? You can find more of that on one of the links up there, the Human Vaccine and Immunotherapy Special Issue. We have all of the data and research articles there too to kind of back some of these messages. So, and then the next one, the American Academy of Pediatrics and the American Cancer Society recommend that children get the HPV vaccine starting at age 9 to prevent 6 types of cancer later in life. So these are strong, these are evidence-based, and we also have toolkits on around messaging, fact sheets, and I believe one of the benefits of age 9 initiation is a video that is really great to show in clinics or with staff. It's about 3 minutes and has a really good impact of why start at age 9.
Yeah, and really all signs sort of indicate that even if your providers start initiation at age 9 with a small group of their patients, that will have lasting effects, and that they will have greater success in reaching better completion rates.
Yeah. Next slide. All right, action 5, leverage HPV vaccination partnerships. If you're on this call, I think you are already doing that, partnering with your ACS staff members with the HPV Roundtable, utilizing that network of both us as well as Roundtable partners. You can see here the Association of Immunization Managers, state immunization managers, comprehensive cancer control coalitions. These are all part of your network that have created resources that have done messaging that can help you with call to action letters for healthcare providers and parents. All this stuff has been created. And so if you're thinking like, okay, this is a huge lift to shift to some of this messaging, to do some of these things, these partners have really great detailed information on how to get started, who to connect with, and some already made resources there. And so that action item I really love on this one is identifying your state level coalition or association to kind of help you as you push forward promoting this within your health plan. Katie?
Yeah, and please remember that in your states, there are lots of other stakeholders that are interested in supporting your efforts in increasing HPV vaccination. So, look to your departments of health. AIM is, a fantastic organization. We were very lucky to have Dr. Shelley Fiskus join us at the summit. We also were lucky to hear from leadership from the Robert Wood Johnson Foundation at the summit. Think about your coalitions. You likely have either a cancer consortium or coalition or an immunization coalition in your state. They want to help amplify your message and also be a trusted messenger with your members.
Yeah. Right. And action 6, implement provider-focused interventions. So here we start to get into a lot more links, so you can definitely dive in this deeper with the link I sent you to download the action guide. But we really talk a lot about provider education and training, whether that's through written materials, videos, CME programs, which I'll talk about one that we currently have active with ACS and the roundtable at the end of this webinar. But you can see here, just talking about training materials that talk about everything that we've talked about in these previous action steps. You need to make sure the providers know how to message HPV vaccination, know how to start at age 9. And so we have all of those materials as well as our partners do as well. And then you can go into some further interventions here with provider reminders and recall. And we have example interventions listed there, whether it's postcards or letters or portal messages. We have more detailed there. And then can you go to the next slide? It should be continued. Here talking about provider assessment and feedback and what are the best ways to potentially go about that. We have some kind of ideas here for you, as well as provider incentives and looking into what that might mean for your group or your health plan. And again, the dark blue boxes are action items. So as you're reading through this, you can kind of circle back up there and be like, okay, what's a first step I should take here? Katie?
Yeah, and I would just encourage consistency and coordination with your provider groups as well as your state. Perhaps they're doing a reminder recall as well, and you can be a little more coordinated in those efforts.
Yeah. And then moving forward to action 7, this is actually our last action, implement member-focused interventions. And so we have information on member reminders, whether that's telephone or printed, some different ideas. And this was a really cool part of the summit too, because there are some innovative ideas going around there. So just to kind of circle back of that, pull in your network. When you get connected with the coalition or with your ACS staff person, they will know the landscape of your state or other states that are doing work, so you can kind of get more information on, what would work for your plan as well. And then moving into member incentives. So, and then member education, which we have a lot of resources around that. Example intervention starting HPV vaccine education before age 9 was a cool one that came up in the summit too that we hadn't really thought of. We talk a lot about starting at age 9, but should that education start prior so that when they're coming in at age 9, they already feel prepared for that age 9 visit. And so we have some more information around that as well. And then social and digital media. Anything, Katie, on that?
Yeah. ACS actually just put together a social media back to school toolkit. We'd love to share that. If you're working with an ACS staff partner, I encourage you to talk to them. But definitely, check out the links that are included and the roundtable website. We have lots of parent engagement materials for your utilization.
Yeah, and Katie brought this up earlier, but it's in our social and digital media, but include personal stories from parents. I think we heard a lot about that of a physician, even that's a parent, talking about their experience and those personal stories, both around getting the HPV vaccination as well as caregiver and survivor stories, really do tell that full messaging of why we do the work we do and why HPV vaccination is important. Next slide. And then here we have hopefully all the links and resources you should ever need. But we have on here the page that I put into chat for health plans and HPV vaccination. We have our resource center, video abstracts to the supplement that I talked about with HVI, as well as following ACS and the roundtable on any sort of social channels. I did want to point out our YouTube channel, especially for the roundtable. We have this webinar will be on there, as well as any other training opportunities as well. So to check that out. And then our references and resources are listed on the final page. And then we're going to move into some resources that are available for you guys. But before I do, Katie, any final words on the action guide?
Really just a big thank you to the roundtable, to all our health plan partners, to the ACS staff that have been working on this through the last year and engaging their partners. Thank you to FTI and thank you to Hager Sharp, who have both helped in this work over the last year. So Tina and I are very appreciative of all of our peers and colleagues who have been eager to receive this resource and have helped us along the way.
Yeah, it's definitely been a labor of love for so many of us together, and it's really exciting to roll this out to you guys and just see the power that it's going to have. So thank you, like Katie said, to everyone and to you guys for sharing it and getting it out into the world. So resources, we have currently a free CME provider education series that's active only for a couple more weeks. So you can register here, but it has the modules and they are on demand as well here. And if you go to the next slide, we have on the 28th, our next best practice series from ACS, and you can register for that with the QR code, or these slides are on that health plan page, so you can use clickable links on that as well. Next slide. We talked about round sources, a lot of information around why start at age 9. We have different evidence-based fact sheets such as rural disparities. We include resources from our partners. We have here a fact sheet on the announcement approach and education. That's a great tool and clinic around that. We have our action guides. You see down there in the bottom right. So all of these things are available. They're free. Please download, please utilize, and let us know what's missing or what you need to help you do the work better. Next slide. And then we do have our national meeting coming up in October that is open to the public. Everyone can register. It's daily for 5 days from noon to 1:30 Eastern time. And you can register for that. I have the link on here. And then I did see a question about the landing page. We'll reshare, but if you ever need it, if you go to our website, it is in a drop down under news and events, and then it's under initiatives and campaigns, and you'll see health plans and HPV vaccination. So if you just remember hpvroundtable.org, you'll always be able to find the health plan page. Next slide. I think we're there. Yeah. So
Michael's asking, Michael, those are still coming. We are working on a more comprehensive comms toolkit. So that will be coming in the next few months. When it's ready, we'll also, share with everyone as well.
Yeah, any other questions? I think 1 minute remaining. If there's any. This has been fun for us and so exciting to roll out to you guys. Please let us know what you need. We're here to collaborate. We're here to help you with your work. And we love it. So yeah, let us know. Katie, anything?
Yeah. Thank you for all that you guys do. We know that you're working hard to protect kiddos in your respective states, and we are excited to champion your work and work alongside you.